All right, diving into dental radiography, huh? Looks like we've got a stack of info to unpack here.
Yeah, looks like someone's been hitting the books, that's for sure.
Lecture notes, student worksheets, we've got it all. So x-rays, huh? From history to what, the actual science behind them? Where do we even start?
Well, they're pretty fundamental to dentistry, more than people realize. It's not just about finding cavities. They give us a whole picture of what's going on, beneath the surface. Really important for keeping smiles healthy.
Okay, so let's break it down for everyone listening. I'm sure there'll be x-ray pros by the end of this.
All right, so a little history lesson first. Did you know the first dental x-ray was taken way back in 1896?
Wow, really? That early?
Yeah, it was just a year after x-rays were actually discovered.
Yeah.
Crazy, right? There was this dentist, Otto Walkhoff, and he was so fascinated by this new technology that he actually experimented on himself.
Wow, talk about dedication.
Right?
But it makes me think of those old movies where scientists are messing with radiation without really knowing the dangers.
Yeah, and sadly that was the case sometimes. There was another dentist, Edmund Kells, and he was a real pioneer in using x-rays on patients, but he also used his own hand for experiments. And, well, all that exposure eventually led to cancer, and he had to have his arm amputated.
Oh, wow. That's a pretty stark reminder, that x-rays are powerful and we got to use them responsibly.
Yeah.
Speaking of which, how do these images actually get created? What's going on inside that machine?
Well, you can think of an x-ray machine like a high-tech camera, but instead of using light, it uses radiation to capture the images of your teeth and bones. And the tube head, that's where the magic happens. It's where the x-rays are actually generated and directed at the teeth.
So the tube head is like the lens of the camera focusing those x-rays.
Exactly. And just like a camera, you can adjust the settings to control the intensity and the duration of the exposure. But here's the thing. Not all of those x-rays actually hit the film or sensor to make the image. Some of them scatter in different directions, and that's where, potential risk comes in.
Okay, so it's the scattered radiation that we got to be careful with. What makes that a concern?
Well, the scattered radiation, it's almost like the x-rays go rogue. They bounce off the tissues, and that can potentially cause damage to cells. But dentists take a lot of precautions to minimize that exposure. That's where the ALARA principle comes in.
ALARA, right. I've heard of that.
As low as reasonably achievable.
Right. So it's all about keeping that exposure down.
Exactly. That's why you wear a lead apron, right?
Yeah.
It shields your vital organs from that scattered radiation. And dentists use fast film or digital sensors, which need low radiation to make a clear picture. So they're always looking for ways to, reduce exposure and make things as safe as possible.
Well, that's good to know. Okay, so we've got these x-rays now. How do dentists actually read them? It seems like some kind of secret language.
Well, it does take a trained eye to interpret x-rays, but I think we can break it down. The key is understanding those two terms, radiolucent and radiopaque. Do those sound familiar?
Vaguely. I think I need a little refresher.
Okay, so think of it like this. Radiolucent areas, those are the dark areas on an x-ray. It's where the x-rays kind of pass through easily, like, with soft tissue or air.
Oh, okay, so like a cavity would be radiolucent, right? Because it's basically a hole in the tooth.
It could be, but not always. Radiolucent areas can also just be normal anatomy, like the pulp chamber inside the tooth.
So it really takes a pro to tell the difference between a normal dark spot and something that actually needs attention.
Exactly. Now, on the other hand, you've got radiopaque areas.
Oh.
Those are the light or white areas, and that's because they block the x-rays from passing through. So things like bone, enamel, metal fillings, those are radiopaque.
So my fillings would show up as bright white spots on the x-ray.
Exactly. And denser bone would look lighter than less dense bone, which tells the dentist about bone health. They're looking for, changes in density or unusual patterns that could be a problem.
So it's like putting together a puzzle, looking at all the dark and light areas.
Exactly. But remember, x-rays are just one piece of the puzzle. The dentist also uses your symptoms, your medical history, and a good old-fashioned exam to come up with the diagnosis.
Got it. It's like being a detective, putting all the clues together.
Right. And speaking of detectives, dentists use x-rays to look for common dental problems, cavities, periodontal disease, even fractures.
Okay, I'm ready to put on my detective hat.
Yeah.
What are some telltale signs they look for?
Well, cavities usually show up as radiolucent areas in the enamel or dentin of the tooth. But again, not every dark spot is a cavity, so it takes training to know the difference.
Makes sense. What about gum disease? I know that's a big deal.
Yeah, periodontal disease, that's a serious concern, and x-rays are crucial for evaluating it. One of the key signs is bone loss. That shows up as like a decrease in the height of the bone around the teeth.
So the bone level should be pretty high up on the tooth, right?
Exactly. And if it's receded, that can be a sign of periodontal disease or some other problem going on.
So x-rays aren't just about finding cavities. They're about the overall health of our gums and bones, too. What else can they show?
Well, they can detect abscesses. Those are pockets of infection that form often at the tip of a tooth's root. They usually look like round radiolucent areas on the x-ray, and there's often bone loss around them, too.
Ooh, those don't sound good.
No, they can be painful. They often cause throbbing and swelling.
So those are the circles of doom on an x-ray. What about fractures? Can you see those, even small ones?
Absolutely. Even a hairline crack that you might not even feel could show up as a thin radiolucent line on the x-ray running right through the tooth.
Wow, that's incredible detail.
Yeah, they're powerful tools, but they do have their limitations, and it's good to understand those too.
Limitations? Like what?
Well, one thing is an x-ray is a flat image, right? It's a 2D representation of a 3D object. So sometimes there can be some distortion or overlap of structures that makes it hard to get a clear picture of everything.
So it's like trying to understand a landscape from just a single photo.
Yeah.
You're missing some of the depth and detail.
Exactly. And even with the best technique, there's always a little bit of room for error. That's why, the dentist always combines x-rays with a clinical exam and everything else to get the full picture.
Makes sense. Okay, so let's talk about some of the errors that can happen with x-rays. What are some of the common ones?
Well, one of the most common is elongation. That's where the tooth appears longer than it actually is on the x-ray. It often happens when the x-ray beam is aimed at the wrong angle.
Elongation. So it makes my teeth look like they have extra long roots.
Yeah, it can create that illusion. And then you have the opposite, foreshortening. The tooth looks shorter than it really is. Again, usually because of the angle.
So it's all about that angle. What are some other errors to look out for?
Well, there's overlapping. That's when the edges of two teeth overlap on the x-ray, so you can't see the contact point clearly.
Overlapping. I could see how that would be a problem, especially if you're trying to spot cavities between teeth.
Exactly. And then there's cone cutting. That's when the x-ray beam doesn't cover the whole area, so you end up with a blank or partially exposed spot on the x-ray.
Cone cutting. That seems like something that could be easily avoided.
It happens, even to the best of us, if you're not careful. Those are just a few common errors you might see.
It really highlights how important it is to have a skilled and experienced dentist taking those x-rays.
Absolutely. Okay, so let's move beyond those errors and dive deeper into, that fascinating world of radiographic interpretation. Specifically, let's look for signs of those radiolucent and radiopaque conditions we discussed earlier.
Okay, detective hat is back on. What are some of the conditions we'll be looking for?
All right, so let's start with those radiolucent conditions, the ones that show up as darker areas on the x-ray. We were talking about cysts earlier, those fluid-filled sacs that can pop up in the jawbone.
Right.
Most of the time, they're totally harmless, no symptoms or anything.
So you're saying I could have a cyst in my jaw and not even know it?
It happens. They often just show up on x-rays, during a routine checkup. But sometimes they can grow larger and start pushing on things. And that's when you might get some pain or swelling or even bone loss.
So even though they're usually no big deal, they can cause trouble sometimes. What causes these cysts to form in the first place?
Well, the most common type is called a periapical cyst, and it usually starts at the very tip of a tooth's root. Usually it's a tooth that's been infected or maybe injured in some way.
So it's like the body's way of walling off the infection, protecting the rest of the jaw.
Exactly. It's like a little protective barrier.
Yeah.
And the good news is, if you treat the infection, like with a root canal, the cyst often shrinks and disappears all on its own.
So a root canal could be a 2-for-1 deal. Fix the infection and get rid of the cyst.
Yeah, in many cases, yes. But sometimes, the cyst might need to be surgically removed, especially if it's really big or causing problems.
That makes sense. Now, what about abscesses? We talked about those before. They're also related to infections, right? But they seem a little more, intense than cysts.
Yeah, you're right. Abscesses are pockets of pus, and they form when you have a bacterial infection. They can show up in different places, but often, we see them at the tip of the tooth's root, just like those periapical cysts.
So they both involve infection, but an abscess is filled with pus, not just fluid.
Exactly. And unlike those cysts, which can be silent, abscesses usually let you know they're there. You'll probably have throbbing pain, swelling, the area will be tender.
Ouch, yeah. I can see why those wouldn't go unnoticed.
Yeah.
how do dentists usually treat an abscess?
The first thing is to drain that pus to relieve the pressure and let it heal. Often they'll do that through a root canal or by making a small incision in the gum. And they'll usually give you antibiotics to fight the infection and maybe some pain relievers to manage the discomfort.
So quick treatment is key when it comes to abscesses. Now, what about that root resorption we were discussing before? I remember it has something to do with the root of the tooth actually breaking down. What causes that to happen?
Root resorption can be caused by a few things, but often it's because of pressure, like pressure from a neighboring tooth, especially one that's impacted and pushing on the root.
So if a tooth is stuck and can't erupt properly, it could be putting pressure on its neighbor and causing the root to kind of dissolve.
Exactly. And sometimes, even too much force from braces can be a factor.
So braces could actually contribute to this problem. That's a bit worrying.
It's a potential risk, but it's pretty rare with modern orthodontics. A good orthodontist will be aware of this and take steps to minimize the risk.
Well, that's reassuring. It sounds like moving teeth around is a delicate business. We've talked about conditions affecting the teeth and bones, but what about the periodontal ligament, that little space between the tooth and the bone? Can X-rays tell us anything about how healthy it is?
Absolutely. That periodontal ligament, it's essential for keeping the tooth anchored in its socket, and it acts like a shock absorber when you chew. On a healthy X-ray, it shows up as a thin, dark line surrounding the root.
So we're looking for a nice even space all the way around.
Right. But if that space looks wider or thicker than it should be, well, it could mean there's inflammation or infection, which are signs of periodontal disease.
So it's like a red flag that something might be up with the gums and supporting tissues.
Exactly. X-rays help dentists see how bad the periodontal disease is, and they can track its progress, which is important for managing it properly.
Makes sense. Okay, we've covered a lot of ground with those radiolucent areas. I'm curious about the radiopaque conditions now, the ones that show up as bright spots on the X-ray. What can you tell me about those?
Let's start with hypercementosis. That's where you get this excess buildup of cementum on the root. It can make the root look kind of bulbous, enlarged on the X-ray. Good news is it's usually harmless and doesn't cause any problems.
So more of a cosmetic quirk than a real issue.
Usually, yeah. But in rare cases, it can make it difficult to, extract a tooth or do other procedures.
Okay, interesting. Now, what about condensing osteitis? You mentioned that it's an area of increased bone density, which sounds like a good thing, right? More bone, stronger bone?
You'd think so, but it's often a sign that your body's trying to fight off an infection, a chronic one, especially around the roots of teeth with big cavities or an infected pulp.
So it's like the bone is reinforcing itself to try and contain the infection.
Exactly. Now, condensing osteitis is usually painless, but it can sometimes make root canal treatment a bit more challenging.
I could see how that would be. And finally, those pulp stones, the tiny calcifications that can form inside the pulp chamber. You said they're usually harmless, but can they ever cause problems?
Most of the time, they're just a little interesting finding on the X-ray, nothing to worry about. But if they're big, or if there are a lot of them, they can sometimes get in the way during a root canal, make it harder to clean and shape the canals properly.
So they're like tiny little obstacles for the endodontist.
That's a good way to put it. So we've gone through a lot of technical stuff here, but what I really want you to take away is that dental X-rays, they give us this amazing amount of information about your teeth, your bones, all those supporting tissues.
It's like getting a peek into a hidden world.
Exactly. And by understanding what those radiographic signs mean, dentists can make the right diagnosis, come up with a good treatment plan, and really keep an eye on your oral health over time.
This has been so helpful. I feel like I could actually have a decent conversation about X-rays now.
I'm glad to hear it. Now, before we wrap things up completely, I want to talk about the bigger picture. We've talked about how X-rays help diagnose and treat problems, but they're also key for preventative care.
Preventative care? In what way?
Well, by finding problems early when they're still small and easy to manage, X-rays can help prevent them from turning into something much worse down the line.
So it's like finding a cavity when it's just a tiny speck before it becomes a major construction project.
Exactly. And by tracking your oral health through regular X-rays, your dentist can spot those subtle changes that might not be obvious during a regular checkup.
So it's like having a checkup for your teeth, but on a much deeper level.
Exactly. This proactive approach can really help prevent pain, save you time and money, and most importantly, help you keep your natural teeth for life.
I never really thought of X-rays as a preventive tool before, but it makes perfect sense.
It's something that's often overlooked. Now, to make sure you're getting the most out of your x-rays, it's important to talk to your dentist. Ask questions if you have any concerns.
Communication is key. What kind of questions should I be asking my dentist about x-rays?
Don't be shy to ask about the type of x-rays they're recommending, why you need them, the risks and benefits, any safety measures they're taking. You have the right to be informed.
So it's about being an informed and proactive patient.
Exactly. And remember, you always have the right to refuse x-rays if you're not comfortable or have concerns. But keep in mind that not getting x-rays could make it harder for the dentist to spot certain problems, which could delay treatment.
It's about finding that balance between caution and staying on top of your oral health.
Right. Now, before we get to our final thoughts, let's take a moment to think about how far x-ray technology has come since those early days.
It's pretty wild to think about those early pioneers experimenting with x-rays, not fully understanding the risks.
It was a time of incredible discovery, but it came with a lot of trial and error. And the advances we've seen in dental x-ray technology over the years, they've been amazing. We've gone from bulky film to digital sensors, from long exposures to instant images. It's safer, more comfortable, and much more precise than ever before.
It's a real testament to how much dentistry is constantly innovating and improving.
Absolutely. And with all the research and development going on, we can expect even more amazing advancements in the years to come.
Okay, I'm ready to hear your final thoughts on this topic. What's the most important message you want our listeners to take away from this deep dive?
I think the main takeaway is that dental x-rays are a super valuable tool, not just for everyday dentistry, but in unexpected places like forensic science. They give us a window into a world we can't see, help us diagnose problems, make treatment decisions, and even solve mysteries.
It's like having superpowers, seeing right through teeth and bone.
We've come a long way in our understanding of x-rays, and as technology continues to evolve, we can expect to see even more innovative uses for them in dentistry and beyond.
It's exciting to imagine what the future holds for dental imaging.
Now, before we move on, I want to leave you with something to think about. With all these rapid advances in imaging, do you think traditional x-rays will eventually be a thing of the past? Or will they always have a place in dentistry, even as new techniques come along?
That's a great question. Something for everyone to ponder as technology keeps moving forward. Thanks for taking us on this journey through the world of dental x-rays. It's been enlightening.
It's been my pleasure. Okay, let's shift gears a bit now and dive into another fascinating aspect of dental x-rays, their role in forensic science.
Forensic science. Now that sounds like a story for another time. Forensic science and x-rays? Huh? Sounds like something right out of a crime show.
Well, you might be surprised how often dental x-rays actually pop up in investigations. They're like a hidden record, a unique fingerprint that can help identify people, even tell you a bit about their lives.
I've seen those scenes on TV, where they're comparing dental records.
Yeah.
But I never really understood how they could be so revealing.
It's because our teeth are so unique. I mean, really unique, almost like fingerprints, the size, the shape, how they're arranged, any dental work that's been done. It all creates this distinct pattern, right? And x-rays capture all those internal structures, which adds this extra layer of detail that's, well, it's super valuable for forensic dentists.
So even if someone's fingerprints are missing or damaged, you can still use their teeth to figure out who they are.
Exactly. It's especially important when you're dealing with unidentified bodies. You can compare dental records, including those x-rays, to what you find post-mortem, and, well, it helps figure out who that person was.
That's amazing. It's like solving a puzzle, but using teeth as the pieces.
And think about those big disasters like plane crashes or something where there are multiple victims. Dental x-rays become super important for, sorting through the remains and making sure you're identifying everyone correctly.
Wow, that's a powerful reminder that keeping good dental records is important. Not just for our health, but for potentially helping to identify us if something unexpected happens. What other ways do these forensic dentists actually use x-rays?
Well, bite mark analysis is another area where x-rays can be really helpful.
Oh, like in those crime shows when they find a bite mark on a victim?
Exactly. Forensic dentists can look at the pattern of the bite and compare it to dental impressions or x-rays from suspects.
So a bite mark can be almost as incriminating as a fingerprint.
It can definitely provide strong evidence, but bite mark analysis is tricky. You have to be really careful with how you interpret it.
So it's not always a sure thing, but it can be a good piece of the puzzle in some cases.
Yeah.
Is there anything else that x-rays can tell you about a person, besides just identifying them?
Believe it or not, they can give you clues about a person's age, their overall health, even some of their lifestyle habits.
No way, really. I had no idea teeth could tell you so much.
For example, the way teeth develop and erupt, it can give forensic dentists a pretty good estimate of how old someone was, especially if they're younger.
So even if you don't have any other info, you can get a sense of their age just from their teeth.
Exactly. And things like missing teeth or the condition of the teeth and bones, those can tell you something about their health, maybe even their diet.
It's like teeth are these little time capsules holding a record of someone's life.
It really is fascinating. But it's important to remember that forensic dentistry, this is a very specialized field. You need years of training to interpret x-rays for these kinds of things.
So it's not just any dentist who can do this.
Right. Forensic dentists, they have that special training to look at dental evidence and then, present their findings in court if they need to.
Wow, this whole forensic dentistry thing is really interesting. I've learned so much about x-rays today, from their history to diagnosing problems to, well, even solving crimes.
It's a pretty amazing field with a lot of different applications.
So as we wrap up our deep dive into dental radiography, what's the one big thing you want listeners to remember?
I think the key takeaway here is that dental x-rays are an incredibly valuable tool, not just in regular dentistry, but in those unexpected areas like forensics. They give us this look into a world that we can't see otherwise, and they help us diagnose, make decisions about treatment, even solve mysteries.
And with all the advances happening, this technology is just getting better and better. It's pretty exciting to think about the possibilities for the future of dental imaging.
Definitely an exciting time to be in the field. And that's our deep dive into dental radiography.
Thanks for joining us on this journey. We'll catch you next time on The Deep Dive.